Okay. Bismillahirrahmanirrahim. In the name of Allah, the most merciful and the most beneficent. After sending salutations on our holy prophet and his progeny, peace be upon them, I would like to start our topic, which is the prevalence of self-medication in medical students, a systematic review. By batch 28, I am its BR Sayyid Fakir Hussain Bukhari, roll number 299, and I would be giving a brief overview in the form of the abstract of this paper. And then afterwards, my fellow batchmates would carry along the paper. So, starting with the abstract, I would first like to mention the background of this systematic review. We chose this study because self medication among medical students is a serious rising threat to the public health in both developing and developed nations. It has negative effects on the person's health as well as on the society by giving rise to drug resistance, delayed identification of disease, emergence of comorbid conditions, and in rare circumstances, it may lead to death of the person. So, the aim of this study was to determine the prevalence of self medication among the medical students throughout the globe via a systematic review of the studies, the literature published on this particular topic, this niche, on different databases. So, the material and methods which we basically utilized to carry out this study were that we systematically searched four electronic databases, namely PubMed, the Cochrane Library, Medline, and Henari, from inception till September 15, 2022, for studies reporting the prevalence of self-medication in medical students. Our eligibility criteria included, which would be mentioned ahead in this presentation, it included that we would be including cross-sectional, case control, and cohort studies in this review. So after the screening of the articles, 12 articles were finally selected to be included in this qualitative systematic review. All of these were cross-sectional studies conducted in different countries around the globe. The total sample size turned out to be 10,472, ranging from a minimum of 90 to a maximum of 3,326 of a study in Sudan. All these articles, we divided them into three categories based on what they were discussing. The first category, occurrence rate, which all of these studies discussed, then risk assessment, which 10 studies discussed, and risk management, which 9 studies discussed. I would like to shed some light on these three terms which we selected for this article. First of all is the occurrence rate, which would be defining the prevalence of self-medication among medical students, its epidemiology, its frequency among the medical student population. The risk management category was focused at whether the paper identified the variables which were related to self-medication, what were the factors that were promoting this phenomena, this behavior in the medical population. And the third was the risk assessment, which identified the incidence, the extent of self-medication among medical students. The overall prevalence turned out to be 57.93%, with a minimum of 6.4% associated with beta blockers to 89.6% associated with analgesics. The risk factors, the main risk factors in which promoted to self-medication among medical students included Asians, in women, and in low-income countries. The conclusion of the study was that the self-medication is highly prevalent among the medical students across the globe, and it's posing danger to the public health as well as the health of medical students due to their higher knowledge. They self-medicate without any professional consultation. So there must be public health policy and strict regulation device to help regulate and monitor the drug sales as well as this phenomena. Also, access to medical care and health facilities should be made easier, especially in the developing countries or low income countries, so that it might help lower this rate of self medication among medical students. Now, for the introduction part, I would like to hand over to my fellow batchmate, Wajiha Tariq. Wajiha Tariq, on to you.
Assalamu alaikum. I'm Wajiha Tariq Bhatti, roll number 155. I will present a brief introduction of our research. First of all, what is self-medication? Self-medication is a broad term. It is a use of medicine without a valid prescription to treat self-diagnosed symptoms or medical issues. It is based on patient self-belief. Self-medication comprises a range of behaviors from one's self-care to disease prevention and management. As a result of which, it is not only confined to self-administration of the drugs, but also intervention in the lifestyle. It has now become a global issue. Self-prescribing drugs are becoming more common in developing and developed countries. Self-medication have serious consequences, including delayed diagnosis, drug resistance, development of comorbidities, and also death in extreme cases. The stats vary greatly depending on the country. For example, in USA, 71% males, 82% of the females are self-medicated at least once. In United Kingdom and North Ireland, 41.5% of the persons have taken medicines without prescription. And in Spain, it is about 27%. Hence, the growth in incidence of self-medication is a severe problem. The reasons of this increased rate is brought by increased medical consultation fees, easier access to pharmaceuticals, lack of access to medical facilities, and patients' prior personal experiences. The main factors that affect self medications are type of medical or psychiatric diseases, patient's social, cultural, economical standing, countries' policies for drug and sales. The illegal drug selling can also be a contributing factor. Medical students are most susceptible to self-medication, mainly due to they have a greater know-how to medicines and capacity to get information related to drugs, and they have better education. The health decision makers need to have a clear and reliable estimate of the rate of self-medication in order to execute a self-medication prevention programs. Thank you.
Assalamu alaikum. My name is Fazan Satar and I am roll number 301. I will be presenting the materials and methods, the data sources and the search set. In the start of the study, we used two-stage standardized search strategy to find the relevant studies. The most common public databases such as PubMed, Cochrane Library, Medline, and Hinari was systematically searched up till September 2022 using the Boolean operators and the medical subject heading where appropriate. In the second stage of the reference list, we tried to identify the references and use them and identify potential studies which we could use in our studies. The full search strategy is given in the paragraph 3rd. Search result citations were downloaded to EndNote reference management software version S9 and duplicates were removed. Next slide. The eligibility criteria. In the eligibility criteria, we try to include those studies which were dealing with the prevalence of the self-medication in medical students. These studies are mostly cross-sectional case control and cohort, and we try to use the original studies. Those studies which were published in English language in peer-reviewed journals were used, and there was no limitation of geography on the study of region. In the inclusion, we included those studies which were such as letters to editors, study protocols, case reports, and case series intervention studies. They were not included in the study, and the studies with full text without the availability of the full text were also included. Data extraction and quality appraisal. The screening of articles was carried out in two phases. In the first phase, the articles were screened upon the title and abstract. For more thorough information, the abstract of the selected titles was sorted. The abstracts were evaluated by two independent reviewers and who classified them into relevant, non-relevant, and probably relevant. In the second phase, the eligibility of the full text articles were determined by other authors and separately applied to the inclusion and exclusion criteria to potentially eligible studies, and both independently extract the data from the original studies onto a standard Microsoft Excel data extraction form. Any disagreements were apparently checked by the third author and were resolved via discussion. Additionally, data from the qualifying studies was also taken in order to assess the research quality using the Joanna Biggs Institute critical assessment methods for the cross-sectional studies, and articles were evaluated for the methodological quality.
Assalamualaikum. My name is Vijaya Zainab, roll number 157. I will continue from results. First of all, study selection process. The database, 4 databases, PubMed, Hinari, Cochrane, and Medline were searched, and they yielded total of 1526 articles. Then duplicates were removed, that were 185. Then the remaining 1341 studies were assessed for eligibility criteria. Out of those, 1253 studies were excluded after title and abstract screening. The remaining 88 studies were selected for full text screening. Out of those 88, 76 were excluded after full text screening, and 12 studies were included in our systematic review that matched our criteria. Correct. This is the Prisma flowchart, and then characteristics of selected studies. The characteristics of the selected studies are tabulated in both in below tables. All of these were cross-sectional studies conducted in different countries, 3 in Saudi Arabia, 2 in India, and 1 from China, Egypt, Iran, Nepal, Nigeria, Serbia, and Sudan. The total sample size was 10,472. All these 12 studies were distributed in three sections: occurrence rate, risk management, and risk assessment. 9 out of these, all the 12 discussed occurrence rate, that was like 100%, and only 10 discussed risk management, and 9 discussed risk management as well. These are tabulated. Then in the second table, we discussed confounding factors under the sample size, that was minimum of 90 to 1296. Then in different countries, then we identified the main niche of each study. That included analgesics, antimalarials, antibiotics, beta blockers, etc. Then we reported a prevalence that ranged different in different countries. Then we extracted key findings from each studies that included that included the prevalence of each drug separately, as well as possible side effects. Then quality appraisal. Next slide. All the studies were included in the review regardless of their quality assessment. Of the 12 cross-sectional studies, 4 papers were of very good quality, 7 were of average quality, and 1 paper was of poor quality. Then we tabulated these studies according to JPI, Joanna Briggs Institute score, that includes 8 papers. So if the score is 8, it means the paper is of very good quality. If the score is 7, the paper is of good quality. If the score is 6, the paper is of average quality. And if the score is 5, the paper is of poor quality. That's it.
Assalamualaikum, Naza Fatma, roll number 153, and I will continue with discussion. We discovered that self-medication was much more common students because they have more knowledge about the drugs and their effects. In addition, they have easily access to the medicines. That's why they are more prone to self-medicate. That studies also showed that the higher income countries had lower risk of self-medication as compared to low and middle income countries, because in low income countries, the students first of all don't have access to the latest information about the side effects of medicines, then they don't have professional care. In addition, they have low income and they often do not afford to go to the health center. That's why they rely on self medication. The discussions also showed that uh, women are more prone to self medicate as compared to men because they often face menstrual and gynecological issues in their life, and they take medicines for them and also search their issues. That's why they rely on self medication. Asian students are more prone than the Western students to self-medicate. It's because it is common in their culture, and it also relied by this racial, economic, and social variables. In their countries, the medicines are also readily available, and there is not much awareness about the harm effects of the medicine. That's why they self-medicate. In addition, we can say that the self-medication is a global problem, and many countries are taking various measures to lessen it, but there is still an increase in the self-medication. In addition, some studies show that there is a relationship between self-medication and the mean age of participants. The younger students are more prone to self-medication as compared to the older ones, because as for the older ones, if they had taken self medications even once in their lifetime and they experience some risk factors, then they do not take self medications in further lifetime. That's why the younger ones are more prone to self medicate. Thank you.
Assalamu alaikum. My name is Sayyid Momin Ali, roll number 300, and I will present the strength and limits of our study. First of all, we know that every study has some strengths and limitations. Following are the strengths of our study. Number one, the sample size was large, and our studies were spanned over a large amount of time as well as over a large region. Because of this, the restrictions were not applied, or of restrictions of the regions were not applied. For example, we will we did not consider that whether the study included following particular region, either it was from Asia, either it was from any European country. We included that article or study in our research. Secondly, the results were also generalized and included studies were from different countries. And the third and most important thing, that this review included standardized and previously validated instruments. As well as our study also has some limitations as well. Number one, that we use the published articles, which may create some publication bias. And number two, the limitations included, the study included only mostly cross-sectional study, due to which it did not most generally include cases or cohort studies. Over a period of time, we could not study that. It only included cross-sectional studies. And the last limitations in our studies, that due to the methodological heterogeneity, we could not perform meta-analysis of the study. Thank you.
This is Taimur Wajid, roll number 302. I will go for a conclusion. From the study, we concluded that there is significant increase in self-medication among the medical students throughout the globe, and we have to advise the policymaker and health maker to design and implement programs and to guide the masses about the dangerous effects of the self-medication among the students, especially children and in adults. And we have to increase the regulation over the drugs, over the counter drugs, and we also have to make the medical facilities and doctors to have good access, and so that the students can readily access to the medical facilities and doctors to and avoid the self medication. Thank you.
Assalamu alaikum. My name is Talal Haider, roll number 303. Now I will talk about references. As far as references are concerned, we have to write references in Vancouver style. In Vancouver style, we first have to write the names. For names, we use numbers to write author names. The authors are always referenced with the help of number. And as far as the name of author is concerned, we use the last name first, and then we will do the initial name. For example, if the name of the person is John Smith, we will write Smith first, then dot J. And then we will use, and if there are more than six authors, we will write the name of six authors. Then we will use extra, etc. or other and as far as the general name, then we will write title. As far as the title is concerned in our study, which is the prevalence of the self-medication in medical students. This is the title. And if there is any subtitle, we will also include that. And then journal name. Journal name, for example, in an example, when the implication for study using stored Saira, which is a general of medical virology. And then we write the name of the year. And for example, this is 2022, we write is here apostrophe semicolon. Then we will write the name of volume and the issue, then pages. For example, the volume 2001 semicolon 83 bracket 11 colon 1900 to 1904. Moreover, in Vancouver style, we have to refer with websites. And, for referring a home page, a website, it is necessary to provide the title of the home page website followed by the word internet. We will have to use the word internet to refer. And as far as it is concerned, I will explain it with an example. For example, 11 is the number homepage, which is the cancer pain headquarter in New York, then associated with the organization name, and then copyright strike subtitles, and then and followed by URL. Thank you.